the mental challenges Americans are facing.
A real mental health crisis.
Mental health is in the news over and over again. But there might be an even bigger story that's not being reported.
Right now, the mental health system we have in place is incredibly fragile. We don't have enough therapists. We don't have enough therapists in the pipeline.
Our mental health system is being overwhelmed. The CDC reports 1 in 5 Americans have experienced a mental health episode, which means
for every single therapist that we have in the United States, there are 350 people looking for that type of support.
This is Dr. Trina Clayeux. She runs one of the largest mental health care networks in the country, but she says the answer might exist beyond professional care.
I think most of us don't know how to fix the system because it is so fragmented. People tend to think that we just need more therapists. And so we're having to look for other solutions that we hadn't really even considered before.
That's why she's building a whole new model for mental health care, one that's already proven effective in one of the most traumatic situations imaginable.
The police investigation into the worst mass shooting in American history is now in full swing.
The good news is the solution might be closer than a therapist.
I feel like you're about to red pill, blue pill me right now.
Well, come with me. I'll explain everything.
This is Stand Together Presents. Stories, ideas, and advice from changemakers tackling our biggest challenges.
Let's get something out of the way. We're not anti-therapist here, right?
Absolutely not. Our foundation of our organization was built on clinical care. And for 10 years, that's what we did.
Dr. Clayeux's organization built a network of 4,000 mental health professionals called Give an Hour, with the idea that they would donate volunteer hours to people who needed mental health support. To date, they've helped over 2.9 million people. But over time, Dr. Clayeux saw the limitation of using therapists alone in keeping up with the growing demand.
We poured into our clinicians and our professionals to say, you are the solution to the mental health crisis. But what we realized is clinical care was not enough. And so how do you mobilize a nation and really make mental health care accessible to anybody? One of the exciting things is that the solution can be found in other situations besides a therapist's office.
This is a really big idea. What if millions of Americans could get the mental health support they need from people they already interact with in their community?
We realize everyone can be part of the solution. Our focus now is really looking at that community-based mental health care. These are everyday people closest to the problems, and the people closest to the problems have the best solutions. And so if we can empower individuals with the training, studies show this can be just as effective as clinical care.
Okay, wait. How effective is it? In a 2022 comprehensive study by BMJ, researchers found that peer support, both individual and groups, delivered significant benefits comparable to professional care. But what does this kind of community-based care really look like?
2 innovative support models that are effective are peer-to-peer and wellness ambassadors. Wellness ambassadors really can be anyone. These are everyday people who are a part of a community who want to elevate their emotional intelligence.
But Dr. Clayeux says this is more than being just a good friend. Besides being empathetic, wellness ambassadors receive training and tools to learn what to do and say when supporting others in a crisis.
For example, some of the training has to do with when you recognize the 5 signs of emotional suffering, and then also the 5 healthy habits of emotional well-being. But then we also introduce some practices or tools that people can use and bring into their own lives. And so the more that we can arm people with good information, the more that they are going to be able to make an impact on their own community.
This model is particularly effective in communities like the military, who have a strong bond but sometimes lack the mental health support they need.
I just even recently had a former service member, had a friend who was really struggling for almost 2 years trying to get into clinical care, and he sees himself as a mentor in the military community. And so we offered to become a wellness ambassador, and he's already doing this kind of work, but now we're arming him with a little bit more information and a few more tools. And so it makes him a really effective change agent, because people will tend to go to people they trust before they'll go to any kind of clinical care. The second model that is particularly effective is peer-to-peer. This model is underpinned by a shared lived experience, and that's what makes it so unique. It's something that someone has been touched by a mental health incident, or they've been touched by a traumatic situation. It's someone who can connect with you easily, who can understand your experience on some level, and who's been there.
So the peer model takes all the training of a wellness ambassador, but its effectiveness is connecting with others through a personal experience, like surviving an accident, drug addiction, or human-made trauma, which are some of the worst situations imaginable.
One of the greatest examples that we have of this is working with survivors of the Route 91 Las Vegas shooting.
We spoke to people from that horrific shooting scene and got their tales of survival.
60% of the individuals who are in Las Vegas were actually from Southern California. All the investment went to Vegas, yet a lot of the individuals who were at that concert the very next day left Vegas with no help, no support system. And from that, there were certain survivors in that community who were looking for more. You could see it, you could feel it, you could hear it, how they were talking. I want to give back. I want to be more involved in mobilizing this community and supporting it. And we invested in them to become peer supporters. And then there's this multiplying effect. And so now when we worked in another community that had a mass violence event, we have individuals who were 5 years into their process. You now had folks who could help you see around the corner. They're people who can help you navigate resources. They're people who can tell you, like, I get it. I get what that incident feels like. And that's where you're seeing communities who can be changed.
Through training more wellness ambassadors and peers, Given Hour's goal is to have community-based models care for 8 million people by 2025.
I think so often that we have been offering mental health as this one-size-fits-all solution that you're missing the nuance, right? There's something in the exchange with another individual when you can really connect with them. There's a reciprocity. There's an exchange where I'm helping you, but I'm actually helping myself. The solutions are with us. The solutions are at the community level. I think that there's such an incredible vibration happening right now when we think about shifting this conversation. It feels like a symphony, and in your symphony, you have all these individuals who are playing different instruments towards the same song. It empowers each one of us to be part of the solution.
Stand Together partners with changemakers tackling our biggest challenges. To see more stories, follow our channels. And to learn more about how you can partner with us, go to standtogether.org.